It is August the 20th. There's only one more Friday in August, and then we're going to be barreling into September, and then it'll be October, and then it'll be November, and then it'll be Christmas, and then it'll be 2022. Oh my. So, I had a lot to talk about last week. I don't have quite as much to talk about this week, but I still have a lot of COVID to talk about. First off, around testing. It's not your imagination. Testing has exploded. Unfortunately, that means that people usually go out to get tested because they're worried about their symptoms. And that's not necessarily a good thing because if you looked at the South Carolina data today, it was not good news. The cases in South Carolina have exploded over five some odd thousand. Um, I think I heard some of the folks from DHEC said that we had the largest single day number of cases, the second largest, excuse me, single day number of cases, period. We were only beaten out by a day in December. This is not good. And that's why testing has really exploded. Through last week, I don't have this week's data. We're still trying to collect it, but through last week, to give you an example, at the same time in July, we were doing about 204 tests every 2 weeks. Every 2 weeks, mind you. Last week, for the same for a 2 week period, we did 1,652. It's not your imagination. Testing has really ramped up, and that kind of has put a squeeze on us. So be patient. Please help with this flow. We're scrambling to get back into the habit of drive-through and work that in with now our rapid testing capabilities. Because remember, when we were doing drive-through in the past, we weren't doing rapid testing then. So now it's kind of like a new ball game. Uh, and it's a really important ball game because Delta is really ravaging the state in terms of the toll it's taken. Vaccinations, I wish I could say that vaccinations have increased as much as testing. They have increased, though. The same period that I'm looking at, the month that was the 2 week period ending in July, a month ago, we did 142 first doses. Now, I like to think about first doses because that's people that have really stepped up and said, I want to be vaccinated. The same point last week, 2 week period, 1 month later, 339. So that's not bad. And we've actually had three staff just last week, two, and then one earlier in August. So we've had three staff that have stepped up and gotten vaccinated. Um, Sometimes folks, staff, patients have had to wait a little bit until they could get vaccinated for a lot of different reasons. You know, after you've had the monoclonal antibody, you have to wait 90 days or until your provider releases you. Speaking of monoclonal antibody, uh, all I can say, folks, is mercy. That team over there in Sweet Bee and Hartsville have been running it. In Dr. Smith's own words, it's like a MASH unit. It is really, really rough over there. But it is really making a huge difference to people in their recovery from COVID and to prevent. Because you may have missed this, but in one of my prior videos, I said that the CDC had actually said that anyone that was post exposure, in other words, they had an exposure to someone, just an exposure, they don't have to have tested positive or even had symptoms, that they could get the monoclonal antibody infusion. That really helps prevent them from further having the possibility of testing positive because a close exposure will probably ultimately result in getting the disease. So remember that monoclonal antibody treatment is an extraordinarily successful and very good um, tool in our tool belt to be able to address this terrible Delta. It is effective against Delta. There is not a short supply of the product that we use, Regeneron, RegenCov. So feel free, spread the word. Um, this is really important. It can make a difference to people. I have heard so many testimonies from people, including some of our staff, that have had the infusion. And the difference it makes, I've heard many say that it probably saved their life. Now, that's a pretty dramatic statement, I know, but I believe these folks. So, moving on to other things COVID, our own internal Care South Carolina safety protocols have ramped back up. Of course, I've talked about it. Masking has still become, quite the thing. And I know a lot of people are concerned about what masks should they be wearing and how does this impact their job. The decision and what the CDC recommendations and even OSHA recommendations are that front facing staff who have direct contact with patients without a barrier, and that patient at some time during that direct contact may have to take off their mask or may have to have a prolonged interface or interaction with that person, that staff person. That staff person does need an N95. And I'm really talking about folks like lab, the folks, of course, that are doing the monoclonal antibody. Those are what we would call front facing, and they don't have a barrier when they are doing their hands on work with patients. They're pretty direct and really very face to face. So we're assessing all of this. We want to make sure that we follow all of the appropriate guidelines. There are some stipulations about N95s and fit testing and so forth. You may be asking yourself, what is fit testing anyway? There has to be a special test run individually to see whether or not that N95 fits appropriately. So that's one of the reasons why many of us that are just out there in the normal environments, we aren't candidates for CareSouth to furnish us with N95s. Stay tuned. There'll be more to come around this. Um, Also, briefly, I want to kind of raise an attention to quarantining. There is a difference between um, what we call quarantine and what we call isolation. Quarantine happens after an exposure. Isolation happens after you actually have been diagnosed or tested positive, and there is a difference. We're updating our guidelines, which we'll publish real soon, but go to the CDC. You can see that there is a little bit of a difference between how each of those situations apply if you are vaccinated or if you are not vaccinated. And stay tuned. We'll be getting our guidelines out very soon. In the meantime, our staff know Tracy Thigpen stays on top of them, but we want to provide you with a written, understandable document because, frankly, it is confusing, and I understand. I get confused. That's why I don't want to have to answer questions about, should I quarantine or should I not? Because it is confusing and it's very clinically specific. The last thing around COVID is that we are having a town hall staff meeting to specifically address COVID issues on September the 23rd. It will start at 9 a.m. in the morning. We are going to kick it off with a plenary, with a presentation by Dr. Jane Kelly, the state assistant epidemiologist. Many of y'all are familiar with Dr. Kelly. We're going to give you more information about this. She will be providing updates and very current information, and information which is understandable. I've always been a real big fan of Dr. Kelly because I can understand what she's saying. I can understand, the specifics. And if I wanted to go into a deeper dive research, she also tells me where she gets her information. That's called the evidence-based backup and data. So we're going to give a chance during this for there to be questions. We're going to give a chance for people to pose questions beforehand so that there can be some anonymity. I know how it is. You're in a big group. You don't necessarily want to raise your hand, and maybe people around you are thinking, well, that was a really stupid question, Ann. But we're going to give a chance for that, and just feel free. Um, you know, there'll be plenty of time to think about this beforehand. September 23rd is about a month away, and there's a lot of logistics we have to accomplish. Yes, we will be closing the offices with the exception of the monoclonal antibody treatments. Unless something changes dramatically between now and then and the demand dramatically decreases, we will keep that open. But we will be closing. Your operations folks, your site administrators, and other key folks will start helping you address this. We are figuring out how to make sure that every one of you can either get on Zoom by a remote connection or in your group at your site or your work area. We are very well aware of what the logistics and the computer and IT needs will be for this. That's why we've frankly got to wait until about later in September to be able to address it so that we can get everything ready, so to speak, so that everyone will be able to join this Zoom meeting. We will be holding some additional training afterwards, but not everyone will be required to attend that. So stay tuned. We'll be firming up an agenda. We know we haven't had a staff meeting, frankly, in over a year now. But there are some very critical things about COVID that you need to hear about, and not just from me or, not just from Care South. You need to hear about it from the perspective of this very well known and well respected epidemiologist, Dr. Jane Kelly. We are extremely privileged to be able to have her. So that is coming down the pike. We are committed and we are making arrangements for this. Last, and this is not COVID, believe it or not, there will be the third quarter UDS incentive payments in your paycheck next Friday. So that's good news. I don't know any more than the specifics on that. I don't know yet how much we're distributing, but I do know that we have made some progress in some areas, and the work of taking care of our patients still goes on. And we are so thankful for what you do in the work of taking care of our patients, assuring that our space and work areas are safe for both patients and employees. Please stay safe out there, folks. This virus is really taking a toll. The case numbers are extremely alarming, along with the death. We do know more about how to handle COVID than we knew back in the same time period a year ago. But still, this is still a terrible disease, and frankly, we still don't know long-term impacts of what the disease will have on those who do catch it. So be safe. Take care of yourself. Take care of each other. I'll talk again later. Bye bye.